coordinator here. So just a show of hands, how many of you know what PrEP or Truvada for PrEP is? Perfect. Yay. Okay. So then, for those who don't, Truvada for PrEP is one pill once a day, and it's an intervention that can prevent HIV by up to 90 to closer to 100%. So my role here is to engage our priority populations who are at risk of getting HIV, whether it's because they have multiple sex partners, or if they're in a serodiscordant relationship, meaning that one partner is living with HIV and the other is not. Just because to get access to PrEP, it's a very medically engaging process, because they need to see their doctors routinely, they need to get their tests routinely, and because it's a preventative and more proactive thing that can be, it's a really different sort of landscape for some people who have a much lower sense of health literacy, because they have to do all these certain things. So it's hard to keep up with that. So then my role is to sort of navigate the process and to make sure that they're successful on PrEP. On the STD side, just because PrEP and STDs are related to sort of their sexual health, the Hawaii Health and Harm Reduction Center is committed to addressing the rise in STDs, which we are seeing. So the big three right now are syphilis, gonorrhea, and chlamydia. Hawaii was actually one of the first states to see gonorrhea that was sort of susceptible to some resistance of the antibiotics that are routinely used to treat it. So we work with the Department of Health, and Dr. Wang, who is our provider here, we're going to start rolling out STI screening for our priority populations, which are going to include our people living with HIV, our people who are at risk of HIV, and then our people who are at risk of hepatitis, and all these sorts of things. Any questions?